So, Dr. Diez, you have said that, really your practice is one of those, you really do a tremendous amount, if not all dentistry under one roof. And orthodontics actually, an Invisalign, which is one of the newer forms of doing orthodontics, is one of the things you do. Can you tell us a little bit what is so great about this Invisalign? Everybody toots it. It's on every street corner.
Well, it is a great thing. It really is. I think what attracts people first off is that it's invisible. You really cannot tell, or people cannot tell that you are going through orthodontic treatment. The trays that you wear are clear. So that's very, very attractive, especially for adults who are out in the professional world, meeting with people on a constant basis. That's just a huge plus. But one of the other things that people find out once they start this type of treatment is how much more comfortable it is than traditional braces or orthodontics. A lot of the patients that we treat wore traditional braces when they were teenagers, didn't wear their retainers, and their teeth got crooked again. So they go to Invisalign, and they cannot believe how much more comfortable, how much easier the Invisalign is over traditional orthodontics. And then lastly, it's so fast. Most of our cases with Invisalign are completed within 6 to 12 months. And I don't know if anybody out there remembers going through traditional braces. It was usually at least a year and a half to 2, and sometimes 3 years of wearing traditional braces or orthodontic treatment. So
that's pretty good. Now, how do those? I know that in those Invisaligns, you're making a tray, right? Or the company, the Invisalign company makes a tray, and they make many of them in advance, computerized or something like that.
Right.
Now,
that's right.
Does the patient get all those trays and he does that himself, or do you give him one by one? He has to come in. How often does he have to change them? What's the deal there?
Typically, what we do, and every case is different, but the average is we give the patient 3 sets of trays. Each set is worn for 2 weeks. Okay. So that way we can monitor and make sure the teeth are moving the way they're supposed to. Sometimes in more difficult cases, we'll do 2 sets of trays. But most of the time, the patient's coming into the office approximately every 6 weeks to evaluate the progress, and then 3 more sets of trays are given.
I see. So, and what about if a patient, loses one? And I know those trays can be taken out, right? I mean, the patient takes them out for eating, right?
The idea behind the Invisalign tray is you're supposed to wear it 22 hours a day. And basically the way we put it is you take it out to eat and to clean your teeth, right?
What about kissing?
There's no kissing. You can't kiss at all. So.
For 9 months, no kissing? I mean, that's even bad for a 15-year-old, or maybe it's specifically bad for a 15-year-old. I don't know.
Just think how good your love life is going to be after your teeth are beautiful and straight. So that's the way you got to think about it.
You make up for it thereafter, or what? I don't know.
I'll tell you what. I watch patients take those trays out in half of a second. So if they really want to kiss somebody, they can kiss them and put the tray right back in. It's really not difficult. It's really not difficult to do.
So you're saying that what you're saying is that first of all, are those things really invisible?
They are. I'll give you a perfect example. This is not an exaggeration. Mm-hmm. One of the first courses or seminars I went to, I think it was a 3-day seminar, and I think the middle of the 3rd day, the instructor pops his trays out. He'd had them in the whole time. I never knew it, and I don't think anybody else did either.
Wow, you guys are dentists, because I know looking at, talking to dentists, I mean,
you stare at your teeth all the time.
Away, they say, oh, you've got 2 crowns,
I'll give you another example. I've already had 2 assistants. I'm having a hygienist. They are talking to patients all day long. They wear them, you know. And sometimes a patient will ask about Invisalign, and my assistant goes, and the patient's like, "Stunned me. You're wearing it now." The patients truly don't realize it.
Wow,
it's clear.
That's incredible. And even there, if that, back to my funny joke, I don't know whether it was funny, but anyway, to my attempted funny joke, that, you know, if that person, you know, adult, teenager, doesn't really matter, somehow is self-conscious at the beginning, that, you know, people do see it.
Right.
Until he overcomes that, which may take him a day or maybe take him a month or two, whatever. During that time, if that all-important job interview, that all-important first date, and if he takes it out for that hour or two, would that be the end of the world? Would he ruin his trip?
That's not going to hurt anything. It really doesn't. I don't like to say that too much because then people start to cheat more.
No,
but no. And again, that's one of the huge advantages. Let's say you have a very important date, okay? A very important interview, a very important event. It is not the end of the world.
Which I do as soon as I'm done with your video here with my wife, I might want to add, okay?
Are you wearing Invisalign right now?
So go on. So if you have that important date, you can take it out.
That's right. Not a problem. It will not alter treatment. Just put it right back in when you're done.
Right. And of course, because you can take them out, must take them out, I think, while you eat, brushing and flossing is still a normal procedure like you would not like when you have the wires, the braces on it, where your wires act like a flag post for the spinach, you know, kind of like the spinach keeps waving on it, right?
Right, and not only brushing and flossing is a normal procedure, but eating, which is kind of important to most people, is a very normal procedure. Okay, it's a normal function, which anybody who's worn braces knows they can be a nightmare sometimes, depending on what some certain types of food that you eat. Well, that problem is not there with Invisalign.
And what about, there are some orthodontists and dentists, of course, you know, who say that Invisalign isn't for everybody. What's your take on that?
You know, you can pretty much treat any case that can be treated with traditional orthodontics can now be treated with Invisalign. The biggest concern that a good Invisalign dentist has is with the younger kids. I'm talking under 15, the discipline of wearing the tray. Because it's so easy to pop out, you know, we have to stress to the parent and to the child wearing Invisalign the importance of wearing the tray 22 hours a day. So that's really the only concern we have. As far as difficulty of cases, Invisalign, you can treat cases just as difficult that can be treated with traditional orthodontics.
Well, here you have it from Dr. Diez's mouth directly. Thank you very much, Dr. Diez. Bye-bye.
Thank you, Helmut.